and I was standing in my office talking with my planner estimator, Tom Hall. It's the last thing I remember. I have been able to piece together the story, so to speak, from talking with my fellow co-workers and rescuers and other people, because I had this insatiable appetite to know. I wanted to know what happened and what it was like that day, because I really don't remember.
They had set up triage areas in different parts of the hospital in anticipation of more people than the ER could handle. And so... And
they just didn't come.
He went to labor and delivery.
I got a real neat card from him a couple weeks later hailing me as their first male patient. To try to get through it, you had to try to use humor, because that helped you. Sometimes you'd cry about it and sometimes you'd laugh about it. But you had to do both, because if you couldn't laugh about it, then you couldn't deal with it, period, at all.
The nurses were having a rough time. They were crying, because this wasn't what they do. You know, they have the little babies, not these big lugs who are chopped up, which is kind of how he was. I mean, the flying glass had just sliced and diced. He's a very strong person. I knew if they had gotten him out of the building and to the hospital, we were good. At that point, I breathed my sigh of relief and said, now we're moving on. Because I knew he just could overcome whatever happened. I didn't anticipate what would happen emotionally and psychologically.
Having been involved in that memorial process for those 15 or 16 years was what helped me get through my difficult times physically and emotionally, because it gave me a purpose, and it gave me the idea I could work with the same people that were dealing with the same things that I was dealing with. And not everybody heals the same. There is no blueprint for how you heal physically and emotionally when you go through something like this.